People often ask you as an emergency room nurse, wow, how do you do it? And I always say, how do you not do it?
I'm a pediatric ICU nurse.
Assistant nurse manager in the pediatric emergency department.
I'm a clinical nurse 3 at the ACC OBGYN, interventional nurse navigator.
I am a clinical nurse 3 on Davis 14, which is the orthopedics trauma unit.
I am assistant nurse manager for the ENT clinic here at UC Davis.
I had taken care of kids before. I had never taken care of kids all day. When I came here to the pediatric emergency department, it was just different. It was stimulating. It made me think a lot more.
When I came to UC Davis, I was a patient first, and I had already been a nurse for 5 years, and I had a high-risk pregnancy, and I bonded and formed a connection with the nurses that were here, and I was recruited when I was pregnant.
In the cath lab where I currently work, I would get paged in the middle of the night, and a lot of times they're awake and alert, and they're in distress because they're having a heart attack right before your eyes. We can help them like within an hour, they're feeling better. You know, opening up their arteries, putting stents in, and just to watch that and be a part of that is really, really, really cool.
I do see myself in our patients and the uncertainty and fear that they have at first, but then knowing that a connection that I may form with these patients, that it makes them feel comfortable.
They don't always have really good health literacy. They've not experienced the healthcare system. Now they are about to be diagnosed with a cancer or just diagnosed with a cancer, and they don't know where to go and what to do. And I like to think of my job as being the person that makes it easier for them.
A lot of times women put themselves last and they provide so much care and support for their families. So I wanted to be a person that can empower them to take care of themselves. Working in the ENT clinic, no 2 days are ever the same. And I also like that the providers are always willing to teach.
It's busy, you're always learning, you can stay engaged really easily.
What I do is I get to know the patient. And once I see the patient smiling at me, then maybe I'm like, okay, they trust me. And then the patient's families later can tell me, wow, I like Mark. He's a great advocate. I really embrace that, and it's what keeps me coming back every day.
You get to meet people when they're having kind of the worst day and have these human moments with them and try to figure out a way to make it better. It's always different, it's always real. You just have these genuine human experiences. It's just kind of a crazy place to work, but I love it.
Nursing is incredible in that it gives you the opportunity to do many different things.
You just keep learning. Always. I mean, I've been a nurse 20 years and I'm learning every day.
I can't think of another hospital, you know, in the area where you can do basically anything in nursing that you want to. I find it really rewarding to get to help them progress to, you know, getting back out there with their family, being able to chase around their grandchildren or make it back to the golf course.
The people really trust you, and that is something to be honored.
It's really important to me to help them see that this is just a blip in their life story.
I would definitely encourage my daughters to become nurses.
I'll be honest, it takes a lot of hard work, but the end outcome is so worth it.
Sometimes I feel like I'm getting more from the patients than I'm giving. When you think you're giving, I mean, they are always teaching you something and just making you grateful for what you have.
Nursing is amazing. You can move and do whatever you want in this field. And as long as you have your patients at the heart and at the center of your work, you're gonna do fabulous things.